So does the Niplette suction corrector work? Well, the short answer is yes, it does work, because it gives suction to the nipple and will help to pull out and evert an inverted nipple. So it does work. The question is, does it give a permanent solution? And in my experience, and I don't know the answer to this for everybody, but in my experience, and it may be that I'm just seeing people who are coming to me where it hasn't worked, but what I find is that often it will draw the nipple out, particularly in the kind of early stages, kind of grade 1 inverted nipple, where you can evert it and it stays everted. It will draw the nipple out, but it often doesn't give a permanent solution, and sometimes patients will say that it will bring the nipple out, but then when you take it off, the nipple will invert again, and that's particularly true for your grade 2 and grade 3 inverted nipples, which are ones which, when you pull them out, they either retract in or whether they're just completely unable to evert them at all. And so for those grades, for the more severe grades, I think it is less likely to work. And the other thing that leads me to that is when I actually do surgery on patients who've got inverted nipples, the most effective way of doing the surgery is by cutting those ducts which are shortened, which is causing the inversion of the nipple. It's actually quite hard to cut the ducts. They're often quite scarred, and they're really quite tight and hard to cut. So you kind of think in your mind, how is something just kind of giving negative pressure going to somehow stretch those ducts and lengthen those ducts? You kind of think, well, I can understand why that's not going to give a permanent solution, because it's actually quite hard to cut the ducts, and even when you cut the ducts, you then worry about being filled with scar tissue and it inverting again. So there's a risk of recurrence even when we do surgery, but we do minimise that risk by bringing some tissue underneath those ducts and putting some extra support in there. But I do think that the Niplette suction corrector is worth trying. I don't think there's any harm in it, although sometimes it can cause some irritation around the areola, around the breast, but it's certainly worth trying. But you might find that it doesn't give a long-lasting or permanent solution, in which case you might want to think about inverted nipple correction, which is a relatively simple procedure we do here at the clinic under local anaesthetic. So if you want to have some information about that, we can send you some information and certainly talk about that. But yeah, give it a try. But I think it's only really effective in the earlier stages of nipple inversion.